Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City News and City News 680, and I'll be moderating this chat today. Now, the way it goes is we've been collecting your questions over the past few days for the doctor, and we'll present them to her today. She's never seen them before. All the answers are off the cuff. And if you haven't had a chance to submit your questions, you can do so in this live broadcast, and we'll try to take as many as we can in the short 30-minute period that we have with the doctor. Now, this week, we don't have a theme. We decided to keep it open because we've been getting a ton of different questions regarding COVID-19, and we thought we'd give everybody a chance to get them all out. So we're going to start with our submitted questions. Like I said, there's no real theme, but we've got a few that I've grouped together about the Omicron variant, about boosters, about the Johnson & Johnson shot. So we'll start with the Omicron variant questions. Doctor, are you ready to go?
Yeah, let's go.
Okay, wonderful. So the first question is, Pfizer says a third shot of its vaccine is going to be good protection against the Omicron variant. We actually have an article about this on our website. So does this mean that every time there's a new variant, we'll have to take another booster shot?
It's really hard to predict what a new variant is going to mean. The current vaccines that we have provided good protection against the variants. We had our original COVID, we had the Alpha variant, and then the Delta variant. We know that the vaccines worked well against all of those. And so it really depends on how the variant has changed. How has the virus changed or mutated? Right. And really, the key place where we're looking for changes is on the spike protein, because that's how we actually recognize the virus when we're infected. That's how the vaccines actually work. Right. So as long as the spike protein is mostly the same, we will likely still have good protection with our vaccines, which means that no, not every variant is going to mean a new vaccine.
Okay. And actually, we have a live question coming in already from YouTube. So let's take Ira's question. Ira asks, when will the 5 to 11-year-old kids get their second dose? Will it be before the holiday break?
So the interval, the dosing between dose 1 and dose 2 is now recommended to be 8 weeks. It's recommended for everyone, and especially for 5 to 11-year-olds. That was by the National Advisory Committee on Immunization. Right. The reason for that is the 8 weeks means that when you get your second dose, you've had a longer interval between the first and second dose, and so you get a stronger immune response from that second dose of vaccine. Right. It also, 8 weeks, we know, means that you are less likely to get some of the more significant side effects from the vaccine. So for example, myocarditis and pericarditis, less common to occur in those who had a longer spacing between the two doses. So that's why we are recommending the 8-week interval.
Okay. And let's go on back to our submitted questions here. The Omicron variant is supposed to cause less severe illness. Is that true? And if so, do we still need to be as careful as with the original COVID strain or the Delta variant that we had earlier?
Yeah, I think there have been some early reports that people who have got the Omicron variant had less serious illness. It's really hard to know, though, whether that's really the way Omicron is going to shape out. We're going to need still a bit more data on that. We also have to remember that we've seen with even some of the other variants that the variant can be less mild in people who are younger, but right. People who are older who get the same strain can actually get very, very sick. So I don't think we can conclusively decide yet whether the Omicron is a milder illness. Maybe it's milder in those who have the vaccine compared to not vaccinated. So we're going to need a bit more information.
Okay. And then Wings asks, are the people with the Omicron virus fully vaccinated and are they hospitalized? Have any Omicron patients recovered yet?
Yeah, so we don't have all of this data. I mean, we certainly do have more cases now in Canada, many more in Ontario. Certainly not all of them have been hospitalized by any means. People are recovering. Some have been defined internationally as having a mild illness. Right. What we do know, though, is that where the variant was identified in South Africa, in that community, the vaccination rates were low. They were less than 25%. And that's how the virus probably changed and developed the variant there. But we don't know that, everyone who's gotten it has certainly not been one or the other. There have been some vaccinated who have gotten it and some unvaccinated as well.
Okay. And Diego asks, what are the symptoms of the Omicron variant virus? And should everyone who got their second shot be getting boosters now that Omicron is around?
Yeah, so it's a good question. I mean, the symptoms, again, we expect it to be similar to COVID virus symptoms, cough, trouble breathing, fever, not feeling well, runny nose has been identified, a stuffy nose, for example. And the recommendations for booster doses are evolving, right? And so as of Monday, anyone who's 50 years of age and older, and it's been 6 months since their last vaccine dose, they can get booked for a booster dose. Right. It's important that we do it by age, the older you are, the more you need the booster dose, because we know, first of all, when you're older, your immune response is less strong. It mounts less strong a response. But also, when you're older, if you get COVID, you can get quite sick. Now, 50 is not that old, but even still, that's where we're starting for booster doses to expand them.
Right. Okay. And then this is from Anonymous. Who or what demographic is most vulnerable to the new Omicron variant?
Yeah, we don't quite have that. I think we can probably very safely say if you're unvaccinated, you're going to be at higher risk. And I say that because where it was developed, again, 3/4 were unvaccinated. And then if you have a chronic health condition, you tend to, in general, have more severe illness. If you get COVID, if you're older, you also tend to have more severe illness. Now, the piece about children, it's really hard to understand. Are children more likely to get Omicron? Is it because they're not vaccinated? What kind of illness do we expect from them? I haven't seen any good information on that either.
Okay. Another one from Anonymous. The statistics released by the government and health authorities prove children are extremely low risk for COVID. Why is this being ignored? And they're saying that children are at high risk.
Well, children are at high risk for getting COVID. That's what we're finding now. Now children have the highest rate of COVID-19 by age compared to any other age group. So they are definitely getting COVID. They have the most numbers of COVID across the country. And so if we don't vaccinate our children, they will get COVID. And we can't predict for each child which child will have a mild illness, which child will end up in hospital.
Right.
And that's why it's recommended that children get the vaccine. In fact, nationally, if you look at the data nationally, about 1% of children who get COVID are hospitalized. So it's certainly not zero.
Right, absolutely. And when it comes to transmissibility, like we've been talking about this as well, because we're seeing more outbreaks in schools as well. So doctor, can you talk a little bit about the transmissibility of the virus within a school environment?
Yeah, so again, we have to first understand it. We know Delta was more transmissible than the Alpha variant. How will Omicron play in? And I think this is why in schools we have, why children wear masks, why we keep children in a cohort, why we want them to have physical distancing as much as possible. Spend time outdoors so that they can reduce the risk, and do that screening every day to make sure that we don't bring people into the school that have symptoms. I mean, even limit visitors, don't have parents coming and going into the school to prevent any additional sources for infection. And with all of those things in place, we find that we can actually, despite the number of cases, the rising case counts that are occurring, while people who may be contagious come to school, it doesn't always mean that it spreads in the school. Now we know that the most important metric for cases in school are actually cases in the community. So when cases in the community rise, we can expect to see more cases in schools. And that's why community transmission is really important to prevent in order to keep schools safer.
Absolutely. And Doctor, recently we've been seeing a couple of outbreaks. Some schools have been closed down. Do you feel, or do you predict that perhaps this will be sort of a blanket thing that schools will close down again? Because I know a lot of parents are worried that schools are going to shut down again.
our commitment really is to try and keep as much school open as possible, to have children attend school in person. We've said as Toronto Public Health that certainly is our commitment, because that is the best place for children to learn. I mean, they have missed an awful lot of in-person education, and they have suffered as a result of it.
Yeah.
So, but in order to be able to keep that, to maintain that, one of the things that we've seen is we have to keep track of our cases in the community. And that's when schools have shut down, all schools have shut down. It's because the community case rate has been so high. Right. And so that's really the marker that we have to follow.
Right, absolutely. I mean, they're connected. Schools are within the community. So if like you said, if the community spread is high, it's going to affect schools. We have a follow-up question from Ira on YouTube. What date can we expect the second doses to arrive for 5 to 11-year-old children?
It's the same vaccine that is given for the first dose and the second dose. So once a child is eligible, 8 weeks have passed, then they can book their second dose so that it's, timed to be given at that 8-week mark. Right.
So supply is not a problem in that sense.
That's what we've been told. Yes, is that there will be enough supply. Exactly.
Okay, wonderful. And then let's move on to some more of our submitted questions. Okay, here we go. Maggie asks, why are partially vaccinated people having less breakthrough COVID infections than fully vaccinated people? I've noticed that as a trend a lot lately.
Okay, so this is a good question, and really you have to look at, you have to consider what we call in science the denominator. So you can't just look at the numbers of people who are partially vaccinated and get COVID. Suppose it's 10, but maybe there are only 100 people out there who are partially vaccinated. That's a 10% rate. Compared to fully vaccinated, maybe there's 1,000 people who are fully vaccinated. If you have even 50 of them who get COVID, the rate is still lower than compared to partially vaccinated. That may have confused you, but really just to say that, yeah, it is a lower risk overall if you're fully vaccinated and get COVID, because there are so many more people who are fully vaccinated.
Right, that makes sense. That makes sense. I think it's more of a numbers thing.
Yes.
Okay, let's look at Bresna's question. Bresna asked, how many people have actually died because of COVID and not with COVID?
So the numbers are reported as those who have died either with COVID or because of COVID. It can often be quite difficult to tease out. If you have a chronic health condition, like you have a heart attack, maybe you had COVID first and then you were admitted to hospital with COVID, we're treating your COVID, and then you had a heart attack. It's really hard to determine, well, if you didn't get COVID, would you have had the heart attack? Which one did you die of? And so that's why if someone dies with COVID, it may certainly have contributed to their reason for death, and that's why those are counted.
Right, okay. Let's see. This one comes from Twitter. Their handle is MTM Crypto. They ask, why is there no talk of COVID being airborne amongst the public health authorities, that it lingers in the air like smoke?
So we do certainly recognize that COVID can be spread by aerosols, and we actually have this information on our website, and that's why we know that it's mostly spread from close contact, and that's why keeping that 6 feet distance is important, because it's the droplets when you talk or shout or sing that can spread to someone if you're close by. But those droplets, the small ones, can get in the air. They can linger in the air. We call them aerosols, and they can stay in the air for longer. And that's why there's a recommendation for ventilation, fully recognizing that those aerosols can play an important role in spreading COVID.
So, doctor, since we know now that it's aerosolized and it can be airborne, are there even further measures that we can take? Because currently, you're allowed to go to a restaurant, you're allowed to go to certain events, but if it's in the air, there's no amount of distance or no amount of plexiglass barriers are really going to stop it. So are there more measures that we need to take?
Well, that's why wearing a mask is so important, because if everyone is wearing a mask, those droplets will not spread into the air. They won't be aerosolized. So I think stopping the spread from the source, we call that source control, is a really important way to help the preventing the spread of aerosols. But, you know, making sure that HVAC systems are up and running. If you don't have one, that you have some sort of a filtration system, perhaps, opening windows. Those are all other really important measures to take. We certainly want to avoid really crowded indoor settings, because that is where and how COVID spreads, both from the aerosols, but also from that close contact from the droplets as well.
Right, right. Okay, let's move on to Ivy's question, and that kicks off a few Johnson & Johnson questions that we have. Ivy asks, where can I book the J&J vaccine? I have been searching for it. I've sent emails, called every office, and still nothing. Please help shed some light on what is going on and how to book a J&J appointment.
Okay, so there's going to be more information coming on this. There were a very small numbers of J&J doses that were received, very small. So probably not enough for everyone who wants one. And so really what is required is those who really have a contraindication to getting a messenger RNA vaccine. They cannot get that vaccine. This is the only other vaccine that's available for them. They will be given first dibs. And so really what you need to do is to see your doctor to see if you qualify in that way. Again, we are working on figuring out the exact criteria based on the number of doses, and so hope to be able to provide some more information. But because there was such a small number of doses, it's not the kind of thing that we'll be able to open up a clinic and say anyone who wants this vaccine to come. Right. Now, I think it's important to know that the J&J is a good alternative for those who can't get a messenger RNA vaccine. But I think the studies are quite clear that the J&J, AstraZeneca, these are viral vector vaccines, and they are less effective compared to our messenger RNA vaccines, the Pfizer and Moderna. And so I would still urge people that is the messenger RNA vaccines are a better choice for a lot of different reasons.
Right. And Doctor, like you just mentioned, you know, Toronto is still working out who is going to be eligible for J&J vaccines. So I just wanted to mention, because we had the provincial announcement last week, and in fact, we have a story about this on our website, citynews.ca, that, you know, it's either that you have contraindications to mRNA or you're unvaccinated for whatever reason. So is Toronto looking at sort of an eligibility list? And like you said, you know, the people who cannot take mRNA vaccines will get first dibs. So is there going to be sort of an eligibility list that we can expect from Toronto Public Health?
Exactly. Yes. So if you live in Toronto, and it will be based on an eligibility that, you know, I know my colleagues are working on very, very closely. You know, if you only get 50 doses, for example, of the vaccine, and the demand is higher than that, you really have to have an eligibility list. Right.
And the likelihood of just, I don't want to take the mRNA vaccine being on the eligibility list, that's probably not going to happen. It's not just for people who don't want to take the mRNA vaccine.
The people who will be offered it first are those who cannot take an mRNA vaccine. Yes.
Okay. And then this is from Anonymous. If you take the Johnson & Johnson vaccine, will we need to take an mRNA booster in 6 months? And what if you can't take an mRNA shot?
Yeah, so in the U.S., they have approved a booster dose for the J&J vaccine. So even while people may think that it's one dose, in the U.S. it is a 2-dose series in that way, because a booster dose is recommended. The booster dose for the J&J is also being reviewed by Health Canada as well too. So you can expect that you will probably need a booster dose. I think that's what the studies are showing in terms of the effectiveness of the J&J vaccine. And, you know, getting a messenger RNA as a booster dose, we know that provides you better protection than getting another, J&J or AstraZeneca for your second dose.
Okay. And then you just mentioned this, but I'm not sure we know this yet. How much stock of Johnson & Johnson are we getting in Toronto?
Yeah, I don't have the number, but it is, you know, compared to the population, the amount that was given overall nationally was quite small by comparison. Yeah.
Yes, and I just have a little bit to add to that, because we did the research for our story provincially, I believe Ontario has so far been allocated 10,000 doses from the federal government, but we've received only 2,500 so far. And I don't know if those have been distributed. We're not really sure how that is working yet, except to say that public health units have to request it from the province. That's what we found out from doing the story yesterday. So just want to throw that out there. Okay, let's see more questions. I think we have some live questions coming in actually. Yeah, let's take a live question from Sarvan. Which COVID antibody test is reliable? If I'm fully vaccinated and my COVID antibody test is positive, will the booster still be required?
I don't think there is a COVID antibody test that is reliable that's available for use. We've seen in the studies that are being done, they often do multiple antibody tests. So it's not just this one antibody. They check, multiple different antibodies or immune cells to determine immunity and a waning of immunity. So we definitely would not recommend getting an antibody test to see if the vaccine is still kind of kicking around for you. I think using time is a better approach. So 6 months after your second dose, is showing that there is some waning of immunity. We're certainly seeing that in the numbers where you are starting to see a few more who are fully vaccinated, who may get a milder illness, for example, and we're seeing that kind of more commonly. If you're hospitalized and fully vaccinated, you're more likely to be older, in which case that's kind of evidence of that waning immunity.
Right. Okay. And then jumping back into our cache of questions. Do you have to prove that you can't get an mRNA shot in order to get a Johnson & Johnson shot?
That is going to be one of the criteria first up. Like, it will be offered to people who are ineligible for messenger RNA because they have a medical contraindication, for example, to the vaccine.
And that would be maybe like a referral from your doctor or allergist or something like that to prove it?
Most likely that's what it will be. But again, that hasn't quite been determined fully yet.
Okay. And then another question here, has the Johnson & Johnson shot been approved for children?
No, it has not. In fact, I'm not aware of any. We call the Johnson & Johnson a viral vector vaccine. It falls in the same as AstraZeneca, and they have not been approved for children. No.
Okay. And then a live question coming in from YouTube. Richard asks, why was the age set as 5 years old and not 4 years old for the vaccine?
It's because that's the age that they used in their trial. So they studied 5 to 11-year-olds. They studied it at that dose of 10 micrograms. There is a trial that's ongoing for 2 to 4-year-olds, and that one actually uses 3 microgram dose, an even lower dose. And so we're waiting for the results of that trial. Hopefully in the new year we'll have it so that we have a vaccine that's licensed for 4 years of age.
Okay. This is a question about booster shots now. The person's alias is booster shot. Should a 67-year-old prone to pneumonia get a booster shot? I'm also a diabetic.
If it has been 6 months since your second dose, yes, I do absolutely recommend that you get a booster dose.
Right. And then when will younger people, younger than 50, be eligible for the booster doses?
So some younger people are eligible right now, like, for example, if they're a healthcare worker or if they have a very weak immune system. The broader population, the province will announce when they will be eligible. You don't want to make everyone eligible at the same time because you won't have enough vaccine clinics in order for people to get the vaccine. So right now we're starting with 50 plus.
Right, okay. Okay, if 2 shots are not good enough protection, how is a third booster shot going to be enough?
So the way the third dose works is that you have immunity already from the first 2 doses. It actually works pretty good, but we know that if we give you a third dose, it will work even better. It will boost your immune response even higher. And we see that with some vaccines. Often there are vaccines that have a 3-dose schedule. Like if you get the hepatitis B vaccine, you get the third dose 6 months later. That is part of how we often give vaccines. And so that's how that third dose will work.
So doctor, do you predict then that the COVID vaccines are going to be a 3-dose vaccine instead of what we first thought would be a 2-dose schedule?
it's a very real possibility that maybe we all need 3 doses. It's a 3-dose primary series. That's the medical term for it,
Right.
and that's what gives us our best immune response. So we'll have to wait to see what the evidence shows on that, but that may be a very real possibility.
Okay. And then what brand is given for the booster shots?
It's recommended that you get the same brand as what you had for your second dose, if both brands are available. It really does not matter what brand you get, but if both vaccines are available and you got, say, Pfizer for your second dose, then you can get Pfizer for your third dose. Now, the only other alternative is if you are 70 plus, you can also consider getting Moderna, and Moderna, it's the full dose of Moderna that's given for 70 years of age and older, whereas if you're less than that, the Moderna dose is the booster dose is half the dose.
Okay. Okay, let's take Sarah's question. As part of the statement from NACI last week, it was suggested that they are studying changing the wording of who is considered fully immunized. Seems to suggest that people who did not receive a full course of mRNA vaccines may not be considered fully immunized. In the case of those of us who received 2 doses of AstraZeneca followed by 1 dose of Pfizer, is it likely that we will receive a second or even a third dose of an mRNA vaccine?
It's really hard to be able to answer that. Again, it goes back to that question that you had. Maybe 3 doses are needed for a primary series. I think if you've had 2 AstraZeneca and a third booster with messenger RNA, what we know is that messenger RNA vaccine kind of brings your immunity all the way up. Like those two AstraZeneca vaccines still did provide immunity, and now with the third messenger RNA, you're boosted up to the level of people who had 3 doses of messenger RNA. That's the way it's seeming right now. So it's really to keep a close eye on that in the coming months.
Right. Okay. And then we have a few minutes left, so let me squeeze in a couple questions. Kathy says, are those who have had COVID-19 immune for 3 months to COVID as well as the variants?
Yeah, this is a good question. This is one piece on Omicron that seems to be coming out that suggests that even if you had COVID, you're likely to get reinfected with Omicron. I mean, we have said that. That's one of the reasons why we say that if you had a COVID infection, as soon as you're cleared from self-isolation, get vaccinated, because that will provide you the best protection. And what I'm not clear on is those people that are getting Omicron reinfection, whether they had their previous COVID infection, more than 3 months ago or within 3 months. But yes, reinfection with this new variant seems to be a very real possibility.
Okay. And then there's a follow-up. During self-isolation, if a person becomes infected on day 14 but is asymptomatic, so they don't know that they're positive, are they infectious on day 15?
So what we know is that if you're in isolation, maybe because you had close contact with someone, most of the people test positive or develop symptoms within the first week. And that's one of the reasons why, if you are in self-isolation because you were close contact, we recommend that you get 2 tests. So they get tested right away, and then you get tested on day 7 or later. And really what we're trying to do is to detect if someone could have an asymptomatic infection. And so that's what I would say is that, make sure you get those 2 COVID tests while you're isolating because of being a close contact.
Right, okay. And then Marcus asks, can you explain the value of wearing a mask and how effective it is in protecting the mask wearer and others?
Yes, so there is actually a lot more really good evidence on how important masks are. So masks can provide what we call source control. You've probably heard that, but maybe not understand it. It means when you're wearing a mask, your germs stay to yourself and your germs don't spread to others. So if everyone's wearing a mask, my mask protects you, your mask protects me. But now we're finding out there's also the other type of protection where when I wear a mask, I can be protected from your germs coming at me. And the way you get that second type of protection is having a well-fitted, preferably 3-layer cotton or cloth mask or a medical mask that is, again, well-fitted, that will give you that 2-way type of protection.
Right, absolutely. And we have 1 minute left. I'm just going to squeeze in this last question. How reliable are the 15-minute COVID-19 tests? I'm thinking these are the rapid tests.
The best test is the PCR test. The rapid tests are less reliable for sure. If you do them once in a while, they're even less reliable. They are recommended to be done as part of a screening program. So if you do it two or three times a week, as part of your workplace, that increases their reliability.
Okay, and that brings us to 1 o'clock. Thank you, everybody who submitted your questions. Thank you, doctor, for taking the time, having the patience to answer all of them. And thank you to those who submitted live. If we didn't get to your question, we will have the doctor back with us next week. And so we'll try and get to all of them then. For now, we'll say thank you and bye-bye. Bye, doctor.
Bye.
And we